Welcome to this short presentation by Parafricta, in which we describe how relieving friction and shear can help to prevent and to treat pressure ulcers. Products containing Parafricta low friction fabric technology can help to prevent and treat pressure ulcers in a number of clinical settings. We produce booties, undergarments and bedding incorporating Parafricta fabric. In this presentation, we're going to focus on using our booties to protect the heel, and we'll explain how relief from friction and shear is the basis of how they work. Heels are particularly susceptible to pressure ulcer formation. The most at-risk area is highlighted in this illustration by the box, that is, where the heel rests against the supporting surface. In this close-up diagram, we can see the various tissue layers that fall between the bony prominence of the heel bone and the epidermis of the skin, which is in close contact with the support surface, usually a mattress covered with a bedsheet. When patients try to move their foot, the forces of static friction will keep the heel somewhat anchored to the support surface. However, as the heel bone pushes forward, the tissues between the epidermis and the heel bone become sheared. This will have a number of effects, including narrowing the blood vessels, tearing apart the epidermis and the dermis, and stretching the tissues, or the cells in the tissues, to the extent that they may be irreversibly damaged. Eventually, the patient will overcome the static friction anchoring the heel to the bed, which leads to a sudden release, snapback, of the built-up stresses. This shearing and release process can be repeated every time the heel is moved, and, over time, the internal damage to the skin accumulates. This process of friction between the heel and the bed, leading to shearing, is illustrated by this animation. As the process is repeated, time and time again, as people continually move their heels, often digging them in to push themselves up the bed, the damage to the tissues and the cells becomes so severe that the process of inflammation will begin to occur. This inflammation is manifested by fluid buildup, edema, and visible reddening. This inflammation will eventually become visible from the outside as reddening of the skin, and this is generally described as a Category 1 pressure ulcer. If the shearing is not managed, a Category 1 can progress to a Category 2 pressure ulcer, in which the skin breaks down completely, revealing the dermis underneath the epidermis. This is a very painful condition, and, if left untreated, may progress even further to expose more layers, eventually right down to the bone. This would be described as a Category 4 pressure ulcer, which is a potentially life-threatening condition. The best way to prevent the effects of shearing is to reduce the friction between the heel and the support surface, and one way of doing this is to use very low friction fabrics. Parafricta fabric is made of a special form of fibre, woven in such a way as to make its surface extremely low friction. This fabric is incorporated into all of our products, including our booties. Parafricta booties are lined with this low friction fabric. The layers slide over one another, they slide over the skin, and they slide over the support surface, which greatly reduces the friction between the heel and the support surface. Parafricta low friction fabric booties offer an easy way to provide relief from friction and shear. They are easy to apply, easy to remove to inspect skin. In certain circumstances they can be used over the top of a wound dressing or to help retain a wound dressing. They are very comfortable and breathable, and the booties are washable at high temperatures and therefore can be used many times. They may be used in the hospital setting, in a care or nursing home, and at patients' own homes. We hope that this short presentation has helped to explain how providing relief from friction and shear using low friction fabric booties can be part of a strategy of pressure ulcer prevention and treatment. If you have other questions about Parafricta products and how they work, please take a look at our website www.parafricta.com, or feel free to call us on 01869 226 566. We look forward to hearing from you, and we hope you have a great experience using our products.